Welcome to Myanmar Musings, a podcast of the Myanmar Research Centre at the Australian National University, Canberra. It is the 1st of August 2021. I'm Luke Corbin, and today I'm bringing you another seminar from the Myanmar Update conference that was held last month at the Australian National University. Today it's a deep dive into maternal and child nutrition by Dr. Sophie Gaudet, an independent expert, with her presentation, How Could COVID-19 Affect Maternal and Child Nutrition? An exploration of impact pathways in Yangon, Myanmar. Sophie is introduced by Aung Jo Mo, who's Executive Director of the Centre for Social Integrity, and there is no Q&A following. So just strap yourself in, enjoy the talk, which goes for about 15 minutes, and see you on the other side.
My name is Aung Jo Mo. I am the founder and Executive Director of Centre for Social Integrity. I would like to introduce Dr. Sophie Gaudet, a senior researcher and technical advisor in nutrition with over 20 years experience working in low-income countries through United Nations agencies, international organizations, Red Cross, and academic institutions. Her recent work investigates the impact of COVID-19 on nutrition and food security in Asia and Pacific. Her current area of interest lies in the practical ways to scale up maternal nutrition and interventions and understanding the nutritional choice for young and adolescent girls in low-income context. Previous research has explored urban undernutrition and metrics to measure cost-effectiveness of the nutrition-specific interventions in urban Bangladesh, India, and Kenya. Thank you so much.
Hi, everyone. So thank you so much for giving me the opportunity to present today. So I will be looking at the impact of COVID-19 crisis on maternal and infant nutritional care practices and health among pregnant women and mothers of babies in Yangon. And we were interested with this data that was at the start of the initial month COVID-19, so in June, July 20, how the crisis has been impacted the delivery of services and practices. So again, it's using the same data by focusing on the urban sample. So a sample of pregnant women or mother who just gave birth and early on. We do have data, and I have just one slide with some updates from all the rounds, but this is from the initial rounds. So the sample at the start, so that's from June, July 2020. So we had about 1,000 respondents and mostly pregnant women and only 200 with babies. And that's quite a novel sample. In a lot of the nutrition studies, it's very hard to reach women who just gave birth or women who are pregnant. So this is really super interesting, a super interesting sample, but obviously with time and as we've been trying to reach the same woman over time, pregnant women gave birth and women with 1 month old baby had older baby. So the sample has been evolving and has changing over time. Again, so this is a Yangon peri-urban and 18 township communities in Yangon, and we have looked at different aspects on access to services via antenatal care platform. I'm sorry, I don't know why So we have included maternal and child health question around health service disruption. And obviously we have quite a lot of income asset data and also the impact of COVID-19 on the household income. So we took all this into consideration in looking at the results. So the first key set of results, it's on nutrition services and nutrition counseling during pregnancy. So we know that women access a lot of preventing nutrition services during antenatal care visits. And so we wanted to know whether this has been impacted during COVID-19. Globally, we do know that COVID-19, because of the measures in place, had an impact on delivery of services. In Yangon, it seemed that the reduction at the start and in June, July 2020, there was modest reduction in access to essential nutrition services. So half of the pregnant women had some disruption of ANC visits. So either their visits were cancelled or postponed, But overall, there was no major impact in terms of the quality of NNC. That's really important because a lot of the services offered during NC visits aim to detect or screen women at nutritional risk. So typically measuring and taking the weight of women during the pregnancy is something that is really important. And it seemed from the data we have that there was no major impact on those services. Also, taking iron folic acid supplement during pregnancy is super important for women, for their health, but also for their baby. It's a known intervention to effective, high impact intervention to decrease the risk of low birth weight babies. And here, 97% reported taking daily IFA or multiple micronutrient supplements. So this is really good. And when we ask whether women changed their birth plan because of COVID-19, only 8% say they did due to COVID-19, and still 92% gave birth with skilled birth attendants and 84% delivered at health facility. And this is also pretty good news because giving birth at a health facility or with skilled birth attendants contribute to increased risk of survival for mothers and babies. But we did note that women in the poorest asset group, so we compared as a proxy for wealth and group women according to 3 groups, so asset low, middle, and high. So that's what you can see on the figure. But when we looked at this, we saw that women in the poorest asset group had less assistance by doctors and also were more likely to give birth at home and not necessarily with skilled birth attendants, but more with traditional birth attendants. Overall, 64% of women gave birth and did receive counseling on feeding. So here feeding is about breastfeeding practices for their babies. So on the key results, number 2, we looked at dietary diversity. And this is crucial for pregnant women and lactating women because quality diet is not just important for them, but again, for their baby. And a proxy for assessing the quality of dietary diversity is asking women how many food groups they consume in the last 24 hours. And the cutoff is 5+. So here, 34% of women did not eat 5+. So they had a poor diet. And we looked at the pregnant women compared to the women who just gave birth, and you see on the graph that there is, very important difference there, and that can be driven by, many reasons. And we suspect here that there is strong food-related taboos after birth that prevent women to eat certain food, and that could explain why the dietary diversity is so poor after giving birth. We also looked according to asset group. So the diet of women in the poor asset group was worse off. Likewise, women who had more COVID were exposed to higher impact of COVID-19 or did not deliver at health facilities. So they had the dietary quality was worse off. And this graph here looks at the data from 2020 to July 2021, so over more than a year. And this is excluding actually the woman, the responses of the woman I've just shown on the pregnant and the woman who just gave birth, because we think that there's quite a lot of taboo influencing their behaviors. So we wanted to see, whether what was the trend for the other women. And then we see that, so still, this is a woman who have a good diet, so who have eaten at least 5 different food items in the last 24 hours. And you see that, 50 at the start, 50% did, and at the end, only 43% did. So we have to look at those results with caution, because obviously the sample changed. The nature of the sample changed, and the sample size also changed massively between the start to the end. But this is just to show you, if we look at the sample from the start to now, there was a decrease by 8 percentage points overall. Now back at to the results in 2020, we looked at breastfeeding. Obviously, this is something crucial for babies. So at birth, it's very important that they breastfed as soon as possible, ideally less than 1 hour after they're being born, and that obviously they exclusively breastfed, so that there's nothing else, that is no other liquid given to them. And so there was quite low early initiation of breastfeeding overall, and especially for the asset group 4. So you can see that in the graph that only 56% of the baby were breastfed. It was less than 1 hour. And we know that if they're not breastfed within 1 hour, they might not be breastfed at all, or there might be issues in terms of securing breastfeeding. And again, breastfeeding is, for example, iron folic acid supplementation is a high impact intervention and crucial for the survival of babies. We noticed that there was a limited disruption of breastfeeding practice because of COVID-19. So for the women who were already breastfeeding, we asked them if that changed because of COVID-19. Only 1.3% said that their practice was disrupted because of COVID-19. So very small percentage here. And then we asked also if there was some food that they were avoiding because of COVID-19. In certain countries, we noticed that women avoided food, and there was a lot of miscommunication on the virus and food. But here, 2% did avoid certain foods. We also looked at low birth weight babies, and this is based on reported data. So we actually didn't check the birth cards of the babies, but we did ask if they had a birth card. But we had almost 1 in 10 babies that reported having low birth weight, and this is much higher than what has already been presented early on in Yangon. And again, this needs to be investigated a bit further. We did notice much higher rate in Langtaya, where we know that there's quite a lot of informal settlements and poor urban communities there. And so taking into all this finding into consideration, we put forward some recommendation for programs. And so we felt very strongly that there's efforts to ensure the continuity of maternal nutrition services should be continued and reinforced, especially the nutrition counseling through various ways and adapting to the situation. So women, even so more now, are reluctant to go to health facilities. So using SMS or other forms of approach to share messages would be really good here. Effort should be strengthened also to promote initiation of breastfeeding in vulnerable group, as we saw that the rates were quite low skin to skin contact. That's really important for mother to immediately breastfeed after birth, and also tackling the taboo, the food-related taboo, to improve the dietary diversity for women who are breastfeeding. They need good quality diets, and so targeted counseling and SPCC should be informed by first, really understanding why they're doing those behaviors and how to overcome the taboo. Finally, there's a need to strengthen nutrition sensitive social protection in poor urban area. So in Myanmar, the maternal cash, child cash transfer program, MCCT, has taken place and has been very successful in reduction of stunting for children. And so this is a cash that is being given to pregnant women until their child is 2. But not many women in this sample did get MCCT. So there was a one-time one-off cash payment that were done in 2020, but since then there was really little social protection program for poor urban communities hold on. Yeah. And then finally, the last recommendation is, having maybe more disbursements and a higher cash transfer just after childbirth to ensure that, again, dietary quality is met. And more ways of reaching those women, so via phone messages. And thank you so much for listening to me, and looking forward to your question. Thank you.
Great. Thank you so much, Dr. Sophie. Nutrition indeed is a very sensitive, and the informations are very difficult to be accessing. So great. Thank you so much for presenting this. And in the interest of time, we'll be moving to our next speaker.